Good evening. My name is Brooke Lakin, and I wanted to present the pilot study proposal that I have for my dissertation. The focus of my dissertation is the transition experience of the novice nursing faculty. The problems that I've seen within the literature and just in my own experience is that there are many empty nursing positions, and the pressure to fill those quickly by administration results in them being filled with people who maybe aren't educators, but they are experts in practice. And so they move from practice, being experts in practice, back down to novice educators. They usually have no training, no education, no mentoring or guidance, except for maybe a leader in their course, a course coordinator. And the need for mentoring these faculty members is very important. And I've seen this in my own experience and then the articles that I've been reading, the desire to be mentored and the need for faculty and administrators to mentor their new nursing faculty. So the conceptual framework that I would like to use is the transition shock by Boychuk Dushner, I think is her name. Her first name is Judy, and she published this. She published this model in 2009 in the Journal of Advanced Nursing Practice, and she focused it actually on new registered nurses. But as I read more articles about it, it became clear that this could also be a framework that could be used for new faculty members. They have a sense of loss from their former selves as experts in practice, lots of doubt regarding their new responsibilities, the lack of knowledge they have in a classroom, feeling confused in having that role stress on them, trying to develop a professional identity. And this is becoming the professional identity is actually becoming a movement within the nursing community, trying to help nurse educators find that quickly in order to increase their job satisfaction and hopefully the longevity in their careers. And then also by using this model, developing and focusing on that need for mentorship, it will increase the focus on relationships, help them to become organized, structure their new roles, and then hopefully develop a sense of maturity in regards to their professional identity as a new nurse educator. So my research questions, I'd like to use a qualitative approach with a phenomenology focused study. And the questions that I like to ask are, how do expert practice nurses handle transition to novice educators? And then my second question would be, how can mentoring be used during the transition period to improve their experience and decrease the transition shock? My participant selection would be a convenient sampling of 8 to 10 participants teaching in a 4-year institution in the southeastern region. The limiting factor would be that they would need 3 years or less of teaching experience to qualify them as novice. The consent would be explained and attained. Confidentiality agreements would also be signed. The initial interview would hopefully start out as a narrative approach. I'd like to hear their stories. Let them just share their stories with me. And I've also included some interview questions that were used in an NLN research study focusing on actually asking questions in regards to nurse educator competencies. There's 8 nurse educator competencies, and these questions were developed from that study, and I've included these in my slideshow. The setting for the interview would be a neutral site off campus in a quiet area where there may be less fear of being heard, which could also help with any type of, curbing their answers in order to not be heard or any type of retaliation that they may feel, just helping to increase the trustworthiness. A timeline would be to reach out to participants. Initial interviews would occur early, mid-fall, and then to take about 2 months to look over those interviews, to code the interviews, possibly using Calais, and then set up a second interview 2 months later. Amend any coding, any changes, any follow-up that I would need to do with the interviewees hopefully this would all be concluded within 4 months. Here are my interview questions that I'm including. These were all, again, taken from the NLN study using the nurse educator competencies. Hopefully I would only need these as follow-up questions, because I'd really like to use the narrative approach. After reading the article that Dr. Arabella sent out, I really think that would be better to tell the story than just a guided question interview. Here are references included. And thank you. I look forward to hearing your feedback.